Times Network presents India Health Summit, a transformational event where healthcare's future unfolds. Policymakers, medical pioneers and industry leaders unite to drive India's healthcare evolution, showcasing innovation and commitment to universal wellness for 1 billion lives.
IMA is the biggest body, not only in India, but throughout the world. More than 4 lakh members with 32 states and 1,800 branches throughout India. This is the biggest IMA body, biggest doctors' body, which has, of course, if it's the last 10 years, has some say in government politics, but not as strong as American Medical Association or British Medical Association. Now, as a modern medicine fraternity, what are the objectives of IMA? To promote and advance medical and allied sciences and all their different branches, and to promote importance of public health and medical education in India.
I am delighted to stand before a distinguished constellation of healthcare visionaries, dedicated professionals, and trailblazing change makers. Each of you scripting the future of India's wellness narrative with wisdom, courage, and innovation. My appreciation to the Times Network for conveying this timely summit. This is not merely a celebration of excellence. It is a clarion call to awaken thought, ignite innovation, and accelerate action in our health systems.
Following the event, an insightful panel drew attention to revitalizing India's healthcare infrastructure, leveraging the digital power.
Dr. Guru Reddy, my first question would be for you. You've built continental hospitals with a strong focus on quality. And, in your experience, how can we really leverage that kind of infrastructure at a low cost?
So from the get-go, when you design an infrastructure, then you need to have a clear vision and a mission. So my vision and a mission is and was, at the end of the day, can I really focus on the human resource that we can train in terms of what constitutes a quality delivery of healthcare?
With the same thought, I'll move on to Dr. A.V. Gorva Reddy. You've often spoken about, providing world-class healthcare at affordable Indian prices.
Yeah.
So how do you think is that scalable, and what model can really work for us?
Affordability comes from the concept. Because the MR scan costs 10 crores, you don't need to charge 10,000 rupees to the patient. And again, the second is, it is in the numbers. And third point is, healthcare delivery cannot be seen return on investment.
I move on to Mr. P. Hari Krishna. And so, given Medi covers, European background and India expansion, what are the designs and planning that you are getting into to really make it an India model?
We from India bring on the table the best doctors. Nobody can match the expertise of doctors like Dr. Guru Reddy with the kind of volumes he manages, with the kind of skill he brings in. But, the European chain will definitely help us in lots and lots of other things like detailing, audit process, construction quality, or be it efficiency in air conditioning system, or many other activities which Europeans have pioneered, and when they couple with Indian skills and Indian way of working or bringing in the cost efficiency, that is proving us and that is helping us to establish better and grow faster.
I move on to Mr. Subramaniam, and we all know that Apollo in some way has led the digital transformation in healthcare. So how do you see that infrastructure complementing physical infrastructure?
Digital infrastructure, by developing the example like telemedicine, tele-ICUs, e-ICUs, these things would complement the physical infrastructures which are available largely in the cities. Say for example, we run a lot of telemedicine centers in Himachal Pradesh where, it's very difficult to even travel. But, we could able to do lot of tele-emergency cases there, tele-ICU cases through this particular thing. So there is an infrastructure, the hub available here physically, but at a telemedicine, at a telemetry level, we will be able to do this particular thing. So the equitability and accessibility can come only this. But I always tell, it cannot replace a doctor.
On the sidelines of the summit, a panel of experts discussed the key insights of reshaping women and childcare in India.
Dr. Pranati Reddy, I would like to start with you. In your experience, how can we better integrate preventive care like early screenings with regular checkups into mainstream healthcare to ensure women across India have access to lifelong wellness?
I think the most important thing that we could focus on, because I think that's really an indicator of the kind of quality of healthcare that a nation can provide, is maternal health, in terms of pregnancy and delivery. And if you look at things like early screening, I guess it will be important for us to start at a point which can be the very worst outcome for a woman who's pregnant. A woman who's pregnant, who's trying to bring new life into this world, if she dies, and that's maternal mortality. And while we've been good, a woman dying while giving birth is a very unacceptable outcome. If you look at that from our own country's point of view, we've been good about it, I think. I think we've brought it down significantly.
So, Dr. Sivaranjani, you've done considerable work in child health. And what do you think now is the hidden danger with adding energy mixes in children's drinks, which is very prevalently happening across the country?
We all know, everybody sitting here knows that adding milk mixes, first thing, dental caries. Second thing, the child is going to develop a craving for sweet taste. And this is the beginning of obesity. Now it's a pandemic now. Epidemic, pandemic, whatever you want to say, obesity is there, and this is the beginning. This is the beginning, and whether it's sugar or jaggery, all the milk mixes are loaded with either of them. We have to stop this.
I'll move on to Dr. Jamuna. So in your practice, what do you find are the most significant barriers to women accessing timely and high quality gynecological care, especially in rural India?
The basic barrier is facility level barriers. Though we have facilities in districts or primary health centers, still they are not updated. Still they have lack of human resource, nurses, doctors, and infrastructure also. And at the same time, the distance for the women to travel, especially from the remote areas, to come to the facility is so difficult. As today somebody said that in hilly areas, we have seen that there are no track or no road. They have to come either carried or, so such is the difficulty.
Dr. Satish, I'll come to you now. So neonatal and pediatric intensive care in India is still underdeveloped, especially in smaller cities. So what are the key infrastructure training gaps that need to be addressed? And with the rise in premature births and critical care needs for newborns?
Yes, if you see across the country, newborn intensive care as well as pediatric intensive care, you have the best hospitals with the best equipment, with the best infrastructure, and the best people to man them. It's not just the equipment and the infrastructure. You need to have good people. It's not the machine alone. It's the men or the women behind the machine. But the problem is, just like how you have the best, you have the most pathetic kind of scene, when you go into the rural areas. So there's a huge divide between the haves and the have-nots, and the urban areas, the level 3 or level 4 centers in the cities, and the rural areas.
Dr. Ruma Sinha, you've been a pioneer in laparoscopic and robotic surgeries. So minimally invasive surgery has revolutionized gynecological care. How do you see the adoption of robotic surgery affecting access to high quality care?
When we talk about women and health, as a policymaker, government, as society, or even family members, the maximum attention the woman gets is when she's pregnant. Everybody will go to the best care that they need. Or at the end of the life, somebody diagnoses that she has a cancer. What happens to that woman when she has menarche at 10 years old, lives up to 80 years old? Who's looking after her gynecological and reproductive health in all those years? And that's something which we need to think about. Women may have simple pelvic pain secondary to simple things like fibroid or maybe suffering from endometriosis. It just gets to the backside and nobody actually brings that to the forward. That is where the minimal access surgery and now the advent of robotics can help these women gain and improve their quality of life.
Technology was at the center stage of the event, and a panel of experts focused on India's health tech revolution, rising from local to global. The event shifts to honoring the exceptional individuals and organizations in the healthcare sector. A celebration of their remarkable contribution to health and wellness begins. Dr. E.C. Vinay Kumar, head of the Department of ENT at Apollo Hospitals, was honored with the Lifetime Achievement in ENT for Telangana and Andhra Pradesh. Dr. Mamta Deen Dayal, founder and managing director of Mamta Fertility Hospital, was recognized for lifetime contribution to women's health and fertility care. Wellness Hospitals, co-founded by Vivekananda Reddy and Asad, with VP Operations Arvind and Chief Strategy Officer Mukesh, was awarded as the best value-based and patient-centric healthcare service provider. Dr. Guru N. Reddy, founder and chairman of Continental Hospitals, was recognized as the innovator in healthcare excellence and research. Birthright by Rainbow Hospital, under the clinical direction of Dr. Pranati Reddy in obstetrics and gynecology, was acknowledged as leaders in safe deliveries. Dr. A.V. Gurava Reddy, Managing Director of KIMS Sunshine Hospitals and Chairman of Sarvejana Foundation, was honored as the visionary in public health and safety. Dr. M. Sai Sudhakar, Senior Consultant Cardiologist at Gleneagles and Wellness Hospitals, was recognized for excellence in cardiology. Dr. Alekia Singapore, founder and chief dermatologist at the Skin Sense Clinics, was awarded for excellence in dermatology and entrepreneurship as a dermapreneur. Dr. C. Vijay Kumar from Apollo Hospitals was recognized for excellence in interventional pulmonology and sleep disorder. Germantown Hospitals, led by Dr. Mir Jawad Zar Khan, Chairman and Managing Director, was acknowledged as the Center of Excellence in Orthopedics and Joint Replacement Surgery. Dr. Vijay Kumar Kurukuri, Founder Director of Sai Hospitals, was recognized for excellence in robotic surgery advancements in rural Andhra Pradesh. Dr. K.J. Reddy, Head of the Department of Orthopedics at Apollo Hospitals, was honored as the legend in knee replacement surgery. Dr. Pujita Devi Suranini, Senior Consultant at Rainbow Hospitals, was recognized for excellence in complicated laparoscopy and high-risk pregnancies. Shri Ramakrishna Hospital, represented by R. Sundar, Managing Trustee of S.N.R. Sons Charitable Trust, and S. Alagappan, Medical Superintendent, was awarded for excellence in multi-specialty hospital in the Kongu region of Tamil Nadu. Dr. Paripati Sharat Kumar, Senior Consultant at Apollo Health City, was recognized as the pioneer in advanced hip surgery. Dr. K. Balakumaran, Founder and Chairman of Krishna Health Center, was awarded for excellence in orthopedic manual therapy practitioner and osteopath in Chennai. Dr. S. Ashish Reddy, Founder and Managing Director of Asian Andrology, was recognized for excellence in microsurgical andrology. Dr. Kokaram Babu, Senior Consultant at Apollo Hospitals, was honored as the visionary in ENT for Telangana and Andhra Pradesh. Dr. Ruma Sinha, Head of the Department of Gynecology at Apollo Hospitals, was inducted into the Hall of Fame in Robotic Gynecology Surgery. The team at Park Dental Care was recognized as the Center for Excellence in Advanced Dental Care. Dr. Satish Ghanta, founder of Little Stars and She Hospital and Choice Foundation, was recognized as the visionary in neonatal and pediatric critical care. Dr. Shivaranjani Santosh, Chief Pediatrician at Magna Centers, was honored as the visionary in first aid and preventive pediatrics. Dr. Vikram Bayer, Consultant Orthopedician at Yashoda Hospitals, was awarded as the Best Emerging Robotic Joint Replacement Surgeon. Calvin Care Life Sciences Private Limited, under the directorship of Chandrakant, was recognized as the Emerging Life Sciences Company of the Year. Dr. Gopinath Bhandari, Senior Consultant at Apollo Hospitals, was recognized for excellence in hand, wrist and microsurgery. Dr. Aarti Deendayal T, Clinical Director at Mamta Fertility Hospital, was recognized as the icon in IVF and Assisted Reproductive Technology, ART. Continental Hospitals, directed by Raghunath Reddy, was recognized for excellence in quality healthcare delivery and precision medicine. Nishan Ali, founder and CEO of Neurologic AI, was awarded for excellence in generative AI in radiology and disease prediction. Dr. Arun Vantela, Senior Consultant at KIMS Hospitals, was recognized for excellence in arthroscopy and sports medicine. Dr. Purna Chandra Reddy, Executive Director at AINU, was honored as the visionary in urology. Dr. Indlamuri Srikanth, Senior Consultant at Apollo Hospitals, was recognized for excellence in implantation audiology. Dr. Srikanth Pesala from Argala Revive was awarded for excellence in physiotherapy care. Prospero Dynamics, founded by Ritesh Dev, was recognized for excellence in robotic innovation for business transformations. Fertilica IVF, led by Dr. Samina Reddy, founder and chief fertility specialist, was awarded as the best emerging fertility center. Dr. Ashwini Kumar Panigrahi from Apollo Hospitals was honored as the icon in nephrology. The team ENT, comprising Dr. Ramya, Dr. Ravi, Dr. Sandhya, Dr. Madhav and Dr. Tejasvi from Apollo Hospitals, was recognized as the best emerging team in collaborative ENT care. The India Health Summit 2025 continues to celebrate the visionaries transforming the healthcare industry. As the curtains come down on this year's event, the pursuit of excellence in health innovation continues.
These are